Hello, I'm Mary Lou Nowak with Resource4 Care and the Aging in Memphis podcast. We record care professionals talking on topics of education having to do with caring for your seniors and your family members. We make that available through the podcast and on YouTube, but the easiest way to access all that information for free is the Resource4Care.com website. And today is no exception. We've invited Lynn Doyle of Unity Psychiatric Hospital, and Lynn is the Director of Business Development. But her career has been in counseling. She has her master's in counseling. And I think that comes in handy in dealing with people and developing business and networking with people. So do you work a lot with families too?
Tons.
Okay.
And the reason is because the families are the ones who are in incredible pain. I mean, obviously we look at the patient. Many times the patient has reached a place in their journey that they're not really sure what their journey is if you're dealing with people with that progression of dementia.
Right.
Or if it's a deep enough depression or anxiety, they're covered up with that. But the family's watching that.
Right.
It's incredibly painful, and it's even more painful to say, what is the next leg of their journey?
Yeah, and we talked about that before coming on live here. What do we think our seniors and their families would like to hear? And the thing we thought would be interesting would be, what are the signs when you are caring for someone, when there are additional or specialty care that's needed, like psychiatric care or maybe memory care? And maybe just educating on that so that if you see the signs in your loved one, you know a resource and you maybe know what to do. So what's your thoughts on that?
Well, let's talk a little bit about dementia and what dementia is. So dementia is very complicated because obviously it's unique to every individual.
Yes.
So dementia also, we are led to think that all dementia is Alzheimer's. Well, Alzheimer's is just one kind of dementia. It is about 60 to 80% of the folks we see.
Right.
So it's a big chunk. But then there's a vascular dementia for folks who've had strokes. There's a frontal lobe dementia for those who've sustained an injury to the frontal lobe. There are, dementias like Lewy bodies that we heard about with Robin Williams and those kinds of things.
Right.
That's more aligned with a Parkinsonian sort of thing. And so it is difficult,
right?
But because they are all different illnesses under this one big umbrella of dementia, and then the patient or the person we're talking about brings in their own unique spin, just like we all will as we get older.
Right.
So, and everybody doesn't get dementia. And dementia is actually not a natural part of aging.
No. That's a misnomer, I think. People think, well, when is it my turn? But that's not actually the case. And in caring for people with my home care, there's definitely behaviors that come up, and trying to find a resource and know where to go to get those answers. What would you suggest, or what should they be looking for?
Well, I think the first sign when somebody begins, and obviously in all dementias, there is an issue with the memory center of the brain. But we all have some issues. I mean, you know that because I talk with folks all the time who go, oh my gosh, I can't find anything anymore. I think I might have dementia. And I go, well, it takes a little bit more than that. Tell me what you're not finding, and do you eventually find it?
Yeah.
And I always use that. I've used this before in us talking with, if I can't find my car in a parking lot where I've parked, join the group. There's nobody, and why is that? Because we're sensory overloaded.
Yeah.
Our brain is just full of stuff.
Right.
So we
do things mindlessly, and
we park the car.
Right.
We go inside. We do other things that tickle those part of our brain.
Right.
The groceries, the whatever. We have 14 conversations. We go out and we go, well, I'll be darned. Can't find that car. I don't know where that car is. And in Memphis, you say, did that car get stolen? Is somebody taking my car? And then you see other people out in the same parking lot who are all doing this. We're trying to find our car.
I know I'm digressing, but I have a funny story. Our Kroger was being renovated, and they were expanding it, and they were messing around with where you could go in and go out.
Sure.
And I told my husband, I think there's zombies in my town, because everybody was walking around the parking lot, like you said, just clicking or looking, and I mean half a dozen at any time.
Yeah,
because they were so confused.
Funny.
You change people's environments.
Well, you do.
Yeah.
And there's some camaraderie in that, which is that is a great story. I'm going to use that. But I always say, if you can't find your car, that's okay. Mm-hmm. Now, if you're out in the parking lot looking for your car and you don't own a car, you didn't drive a car, that's something that's saying this is not right. For example, let's suppose that there is someone who has walked, and they've walked a couple of miles a day, and they walk sort of the same way every day.
Right.
They get to a street and it's unrecognizable to them. And they look at their surroundings and things are not recognizable. Something has happened.
Right.
Because that's what they do every day. Yes. Now, us getting lost in our car and having to call Siri and say, where the heck am I?
Right.
That's a different thing.
Well, and how many times have we just zoned out and go, I don't remember the last 5 miles that I just drove.
That's why there are car accidents. And sometimes that's a part of burnout.
Yeah.
I always say,
and stress.
You miss stop signs, you miss billboards. You say, where did that move? They moved that McDonald's. Well, they didn't.
No.
That kind of thing.
Yeah.
The thing with what we're talking about are a deeper set of symptoms that can be consistent or can roll right off the page.
Right.
So in other words, a change in a routine seems to throw me off. The recipe box that I've been going to for recipes has been on my counter for the last 20 years, and I can't find it.
Right.
And it can be because I've put it somewhere bizarre, like the bathroom cabinet or the in the laundry room.
Right. Or the keys end up in the fridge, or the
keys end up,
and something like that.
And look, there's a difference. That may happen.
Right.
But when it continues to happen, that tells you that your brain is not working. And there's another thing too. If we're talking, just having conversation, and I say, Neil, you told me that you go to church somewhere in East Memphis, and I think I've been by that church. Now, who's your pastor? And you think, not sure. Now but it's back there. And then you get in the car and say, oh my gosh, why could I not tell him my pastor's name? I've known that forever. He's been our pastor for 5 years. I do know that. The good news is most of us whose memory is functional is able to retrieve.
Sure.
So while you may forget it, you're going to remember it.
Right.
That's why we see somebody we think we know in the store, and at 3 o'clock in the morning we wake up and say, oh my gosh, that was that person.
Right. You connect with who it was.
That's all okay.
Yeah.
But the symptoms that seem to be progressive and are incredibly out of character for that person, sometimes you'll notice a little bit of a personality change.
Right.
And here's why you'll notice that. It is a part of the dementia, but it's an interesting kind of part. It's because everybody is not at their same journey in dementia. Okay, so you and I, for a living, we try to make people think we're smart, right? It's part of what we do. It's part of sales. It's part of coaching. It's part of everything, because if they don't believe we're smart and that we've got it together, they're not really going to listen to us. When you're making a presentation, you got to, it's why you tell your credentials.
Prepare and you learn things ahead.
Of course you do, because that's important to you. Well, just imagine that you start noticing that things aren't quite the same. You're trying even harder to make it work. So you notice, your husband might notice, your child might notice, and the rest of us will just say, is Mary Lou, she's burnt out. She's got about 25 different things she
Right.
does. Does that make sense?
Yes, yeah.
I'm not saying that smart people keep from having dementia. I'm simply saying that sometimes if they are in the beginner stages, they're smart enough to know how to cover.
Yeah, yeah. I saw that often where, and I don't want to get off in a tangent, but there are times, this is sometimes when families get impatient because the family member with dementia does a good enough job some of the time, and they put all their energy toward showing up and being present.
Yes.
So then there are times when they can't, or they forget more, or they get agitated because they've expended their energy
That's right.
on trying to keep up and get short, and their personality changes, and the family begins to say, well, that wasn't nice, and I expect more because that person's always been a certain way.
Absolutely. That's great.
I mean, I've seen it so many times, and being in the care business, I'm a half a step away. I'm there and I'm helping, but I'm not a family member. I don't have that history. So I don't have the expectation of the behavior. So I'm more willing to accept things in the moment. But I see it a lot. But when they get challenged,
Yes.
like you said, their behaviors change, and then people judge that.
Well,
or become upset.
What you've said is totally accurate. And imagine, if you will, how we would feel.
Right.
If all of a sudden one morning, and you've had those mornings, I have, where we think,
yeah.
I don't know
Yeah.
what this means, but
I call it the fog.
yeah, I
I
can't.
wake up some mornings.
Yeah.
It's just the
We
fog
all-
is rolled in.
Every one of us blame it on long COVID now. we got
We
that
have a
stuff
name for
it
it.
won't go away. Yeah, but that is truly
Yeah.
a thing. So any of you out there
Yes.
who have it,
We're not mocking
no,
that. No.
because that's a real
Yeah.
thing. But basically, I think you notice that person and what they're doing, and you don't even say as much about it. You don't say things like, oh, you know where that recipe box
it's
is,
just, yeah.
or remember,
Right.
because listen, there is a time when you can't remember, and that's a terrible thing.
Well, I think you tip people off that there's an issue if
do.
you start saying those things.
You do, and I think what you do is you just watch behaviors, you watch conversations, and you don't step automatically to dementia. It's exactly what you said. Maybe they're just having an anxious time. Maybe they're on a different medicine. Maybe we see lots of people.
We see a lot of people sleep deprived.
Oh, totally.
Either they have a UTI or some other type of urinary issue that get them up at night, or they're snoring and don't realize, and it's interrupting their sleep. And people's behavior change a lot when
It
they haven't
does.
had enough sleep.
Even dehydration
That's true.
can make
Oh
a
my
difference
gosh,
too.
yeah.
Not just in your skin, but the way that you
Yes.
think. And we know that memory, because our body is so full of water, we know that we have to ingest lots of water,
yeah.
and that's going to help every system in our body, including our brain.
Yeah.
But I think your question there of what do people do when they notice this? Well, I always think, and some of my colleagues don't feel this way, but I'm going to go out on a limb. I always think a neurologist is a great first step, because
That's interesting.
they're able to look at the brain almost like a
Right.
mapping of the brain. They know, we think of psychiatrists and we say, well, they know all the right questions to ask. Well, so do neurologists, because they work with the brain. So if a neurologist can look at your brain and say,
Right.
guess what I see? I see some signs
Right.
of dementia.
So are you saying you would reach out to a neurologist for some testing, and they would look to see if the brain is, I want to say abnormal, but not as healthy as it could be?
Right. I think a neurologist is a good first step. If there's no time for that, because I'm telling you, sometimes we see folks at Unity who have had memory issues but all of a sudden, it's exactly what you said. They begin to have this aggressive
Yes.
personality where they're
Right.
pushing people,
Right.
or they're being actually incredibly out of character, ugly
Right.
to the people who serve them the best and love them the most.
course, yeah.
Their person, they're just angry. So
Yes.
they put it there,
Yeah.
and then it becomes all very muddled and
Yeah.
chaotic, because it's like, is this memory?
Right.
Or is this just somebody who's just angry with
Yeah.
life? Well,
Right.
certainly that does happen. People get angry at life, but rarely does their personality
Yeah.
so change
Right,
to
without
that
some
degree.
change to the brain. Well, I just had, my dad had some brain bleeds, and we went through that, and it completely changed his personality.
Of course it did.
Yeah.
And brain bleeds, while it sounds terrible, but it's even worse than it sounds. It can do so much damage, as you well know,
Right.
to what's going on. And again, a person who, I've heard you talk about your dad before, who
Yes.
was very in charge,
Yeah.
very stalwart, knew
Yeah.
where he was going, knew where his family was going.
Right.
He was in charge.
Everybody brought him their cars. He would be the mechanic.
Everything. He did everything. He was more than the matriarch of the family.
Right.
He was truly the North Star to everyone. So when he got sick, more than just getting sick happened to your dad.
Sure.
His personality had to change.
Yeah.
And what a difficult thing.
Yeah, and you watched it. You saw him realize that something wasn't right, and then you saw him get scared, and then you saw him go into, being agitated.
Yeah.
So it was hard to watch, and you definitely have to change how you approach things. I was just thankful I had this care journey, so I had some tools to work with it.
If it has gotten to a
Right.
point, is where I was going, if it's
Yeah.
gotten to a point that this person's off the page, and you think, well, they're going to have to be admitted somewhere. Unity Psychiatric Care, where I work, is I love it the most because I work there the most. It's 17 beds. It's all private rooms. We have this humongous staff for a 17-bed facility. We have a psychiatrist, a medical doctor, those two are nurse practitioners who back them, social worker, discharge planner, risk manager.
And how many years have you?
Yeah.
Not you, but how many years has Unity been around?
It's been around for over, I think, close to 14 years now. So it's been around for a while. But the thing about it is that I have lots of competitors who are also great places. Memphis is, unfortunately, a good place to be mentally ill.
Yeah,
it really is.
It is.
It's kind of like we are sort of the cardiac capital. So if something's wrong with your heart, well, the same. If something's wrong with your head. So my competitors are good as well. We're all good at something different, special. We only treat seniors 55 and above.
Right.
That's why we're so small.
Yes.
Is that's what we do.
14
but,
beds. Yeah.
But what we see, which is, I think, in all my competitors, when we have lunch together, they all say the same thing. Families get scared.
Sure.
And they don't have information.
Right.
So they make emotional decisions. If you don't have information, you're making an emotional decision.
Yeah.
Does that make sense?
Oh, yeah.
So,
I just had an example of that. I had somebody call me, and her father had multiple health issues. And she's very smart, because what she's doing is gathering information ahead of time. And she explained where she was, in her journey. And the two things that she hadn't looked at, or three things, one was hospice and palliative care was one. And, we just talked about gaining the knowledge. Knowledge is what helps you have peace of mind.
It's power.
Because then when something does happen, the next stage, you're ready. Just
Absolutely.
To, reiterate what you're saying.
Well, from a caregiver perspective, as you did in your first business or one of your businesses for a while, and you still have your finger in that.
Yes.
You understand that. If I know that I have a mom who's aging, and I begin to see, and maybe she's mentally capable, but I begin to see that she's tripping some and falling some, and the fall.
Yeah.
You don't ever want to fall.
No.
The worst thing.
Exactly.
Some things are happening to her then I don't want to wait until one day I go, she's got to have somebody be here 8 hours a day.
Yeah.
I can't. I
Right.
work.
Right.
Because then I'm just going to the internet.
Yeah.
And or
I
hoping
say
that I have a friend.
Dr. Internet.
Dr. Internet, yeah. We know it's right because it came from, we know it's true because it was on the internet. So the deal is, instead of that, if I can say, I notice this happening. So right now, I'm going to look at different agencies, what they offer,
Right.
How much they cost.
Sure.
All those things are
Minimum
important.
hours.
Totally.
Yeah. Do they charge different for different times of the day?
Do
That
they
type
do
of thing.
respite?
Yes.
I'm only going to need them while I go on vacation because I
Right.
live in the home with my mom. Do
Yeah.
they do that?
Right, right.
And they do, but you have to talk, because then when it happens,
Yeah.
I think I know exactly who to call.
Right.
Mary Lou.
Yeah. Who was
I've got-
responsive? Who answered the phone? Who got back to
Totally.
me? Who do I feel comfortable with?
Yeah.
And you're not rushed to make a decision.
No. And it's the very same with housing, which I'm not going to go into a lot because I
Yeah.
know you've had some housing people.
Yes.
It's the very same thing.
Yeah.
Don't, if your parents, or let's just say it's your mom, and you know that she needs some assisted living,
Right.
but especially if she's still mentally doing pretty good, her cognition is good, her
Yes.
memory's pretty good, make her be a part of that. Mom,
Yeah.
we're going to go see 10 places.
Right.
And you pick the one you love the most. Now, you've done the research and you know what she can afford.
Right.
So you're only going to give her
Yes.
those.
Right.
But you're going to let her be a part of it. Those people who were able to move and they've made some of those decisions,
Yeah.
which older people, it's the thing they fear the most.
Yes.
I'm not going to make any decisions. My family's going to make
I
them
don't
for
know
me.
if everyone's like me, but when we moved my family here many years ago, my first instinct was, let's not involve the kids until we know what we're doing. And I went, as I typically do, and bought a book and read about it, and they gave me the exact opposite advice. And it's what you're saying, involve the person early in the process, because then it's not a shock, and they buy into or tell you what they like and don't like. That's just what they don't like is just as important. And it made all the difference. So, we don't want to have that tough conversation and share that we're thinking about it. But the earlier you involve people,
Sure.
the better.
And you as a caregiver can do all that homework.
Yes.
You need to know what to expect when you walk in.
Right.
But that's important. The same is with a psychiatric hospital.
Okay.
It's or a hospital.
Yeah.
Anything that's inpatient medical,
Right.
you need to research enough to know that's where I'm going to go. If something happens, that's where Mom's going to go. And especially if somebody has dementia. Here's the other thing too.
Okay.
And this is kind of getting out of my lane a little bit. Everyone out there, I'm talking to every one of you out there who has a parent who's aging, we're all aging, but
Right.
is obviously you're the adult child. You better have a power of attorney. If
Oh,
you don't have
yeah.
one, you call today and
Right,
get one.
right.
I suggest if you can afford it, go to an attorney. You're going to work with their
Yes.
paralegal, but I'm here to tell you, get a power of attorney for finance,
Yes.
get a power of healthcare attorney,
Yes.
because when you've got those, and I'm going to give you the perfect example. I talked to a guy this morning. I was talking
Right.
to you about it previous to coming
Yeah.
in here, and it's his brother-in-law.
Right.
Who now is in the throes of dementia and that kind of thing. And the first thing I said was, let me ask you something. Do you have a power of attorney? And he said, does he have a power of attorney? He said, absolutely. That power of attorney is me.
Right.
I have the papers, and that's why I'm calling you. Smart family, because
Absolutely.
here's this little tip. With a power of attorney, if this person has been diagnosed with dementia,
Right.
but they don't want to come in, they can come in on that power of attorney.
Right.
Get those powers of attorney.
Yes.
But look at everything.
Yeah.
You know?
Exactly. We only have a few minutes.
Sure.
Are there other, I know I referred some of my clients to you when there were other behavior issues or medication management
Sure.
issues. Can you give us a few
Yes.
quick examples of other than memory or neurology, specific things like dementia?
We treat people with dementia. We treat people who are just depressed. And when I say just depressed, that was a bad word. They're depressed. They're depressed so much they don't know whether they want to live anymore.
Right.
And so I and all of my colleagues in the city at different places, we treat people with depression, agitation, any a quick mental status change.
Right.
Something's happened. And even though we can't stop dementia, stop the progression,
of course,
we can help the symptoms.
Yeah.
And that's what everybody can do. So, yes, there are many reasons why you would come into a hospital, and don't wait until that person has hurt somebody.
Right.
If you see it happening, if I'm always nice to you, and I start shoving you, that next thing is going to be a hit.
I can remember one client in particular that was getting confused with their medication, which caused other health issues. And she had her days and nights messed up, and basically she could no longer manage her own medication. And it was causing mental as well as physical symptoms.
Totally. And
so it's not permanent.
No.
And you get,
many older people are polydrug abusers. That trips everybody out. But here's the thing: you've got several doctors prescribing things, and they don't talk to each other. So never worry about it, because listen, some people who act just out of their mind get their medicines changed, and things are fine. Get a urinary infection treated with an antibiotic, and they are fine. So medication management is a huge piece of any hospitalization.
Yes. And the other thing that wasn't psychiatric per se, but due to the dementia, getting your days and nights messed up. That way they're not up and about when everybody is, and they're vice versa, walking around at night.
And you can check that out in a hospital. It's difficult to monitor that at home.
Yeah.
And there is sundowners, which we don't have time to talk about, but sometimes that's an issue as well.
So all of those things are things that people come in to a psychiatric hospital to get managed, and the family getting some help.
It's short-term acute.
Yes.
It's 2 to 3 weeks. It's not a long time.
I honestly don't think a lot of families realize they have that as a resource until their doctor recommends it. So
of course,
we're here to say it's an option. It's something to look into if you see behaviors happening. And Lynn is one of the people listed on my website. So if you want to reach out to her, just go to my website, Resource4Care.com, and she's right there with her contact information. And
love for you to call me.
Thank you so much.
Thank you, Mary Lou. Appreciate it.